First of all, I'd like to acknowledge Judith Gardner and Dawn Beisner. Dawn is an alumnus from here, and was an ophthalmologist in Springfield, Missouri. And they have given lots of gifts, actually, across the campus. But one of the gifts was a professorship, which supports me and certainly a lot of the research you're going to see coming up here. Ed has alluded to the problem of macular degeneration of aging. It's the most common cause of blindness in the Western world. And you can see as you get older, the risk of macular degeneration goes up. And by age 80, about 30% of our population has signs of macular degeneration. There's now almost 2 million people in the United States that are legally blind from this disease. And if nothing's done by the year 2020, there'll be 3 million people. And I just read an article in the Archives of Ophthalmology that 18 million Americans will be affected by this disease if nothing is done by the year 2050. And we see this scenario over and over again of people reaching retirement age and they funded their IRA or their 401k and they've watched their diet and they've exercised and they've taken good care of themselves. And now they're looking forward to their golden years and spending time traveling and babysitting their grandchildren, and boom, they're hit with this disease. And it can affect driving, it can affect their mobility because they're afraid of falls, it can affect their reading ability to stay in touch with society, and it can also lead to depression, which is high in this disease. This is an example of early macular degeneration. The yellow spots that you see here in the macula are called drusen. They basically mean cobblestones or pebbles in German because it was first described by a German ophthalmologist. And as macular degeneration progresses, it causes two types of vision loss. And one is atrophy, as you see here in the central part of the macula. Basically, the tissue is just lost, and that's called dry or atrophic macular degeneration. Or it can cause neovascularization, and here you see a neovascular membrane in the center of the macula with fluid around it, and that can cause fairly rapid loss of vision. Now, we always knew that macular degeneration was at least partially or mostly, we feel, a genetic disease. And here you'll see 68-year-old twin sisters, identical twins, and the one sister is on the top here, and the other sister on the bottom, and you can see that their maculas, as far as the drusen are concerned, look very, very similar. The problem with macular degeneration is it's a multifactorial disease, multiple genetics. There are lots of diseases where one gene causes the disease. For instance, cystic fibrosis. Dr. Michael Welsh, actually here at the university, is doing some really great work in cystic fibrosis. Dr. Stone talked about it earlier, those one gene diseases. Basically, if you have that gene, you get that disease. They tend to be fairly severe diseases, but they tend to be uncommon. So cystic fibrosis, we hear a lot about it, but in relation to macular degeneration, there's only about 1,000 new cases of cystic fibrosis per year. The most common and important diseases involve lots of genes working together and also lots of environmental factors, and they include such things as cancer, heart disease, diabetes, and age-related macular degeneration. And these diseases are very important because they're common, but they're also difficult to unravel because there's so many factors that are interacting. If you look at the national research that's funded by the National Eye Institute, they involve big patient trials that involve vitamins or sometimes drugs. And these trials are important, but they're very expensive. They take years to get results. And the problem is that macular degeneration isn't one disease, it's different diseases combined. The other problem with these trials is generally you can only choose one thing to try. You try that drug or that vitamin versus a placebo. And the other problem is it's not really getting to the root cause, or I should even say the seed of the disease. It's just using a certain drug to see if they can ameliorate it. So it's not really leading to a cure. So Dr. Stone has assembled our perfect team here. And we have the patients that he's talked about. We have clinicians. We have bioinformatics from the College of Engineering, statistician, geneticists, biochemists, and research assistants. But we are missing one key to the puzzle here, one piece of the puzzle. But we need all these people working together, like the Hoover Dam, to achieve our cure. The AMD puzzle is a difficult one, and the first thing you do with any puzzle is you start around with the edge pieces. And Iowa has been very successful. We have found the most genes that have been involved in macular degeneration. We've then looked at families, where we've looked at similar patients, similar phenotypes, we call them, and we've then determined the phenotype-genotype relationship. In other words, what gene is causing this disease. For instance, when the experts had a disease called Malatia levantinasa, they noticed that these patients also had things that looked very much like drusen. So they wanted to send the blood samples to the world's expert to try to find out where the gene was located. So they sent it to Dr. Stone here at the center. And he found that it was a fibulin disease, a fibulin gene. And the fibulin is a building block of elastic tissue. And then Dr. Mullins in the lab started to look at the skin of fibulin patients. And you can see on your left, this is normal skin with normal, nice, long elastic fibers. Whereas on your right here, the fibulin 2, in somebody who has a fibulin 2 genetic finding, broken up elastic tissues. They're short and fragmented. So now not only do we have one genetic cause of macular degeneration, we're starting to actually get to the mechanism as far as why it's causing the disease. It's in the very building block of the eye where the problem is. We also looked at a group of patients that are called cuticular or BB-like drusen. You can see this patient has very, very many little drusen, and if you look at it with fluorescein angiography, you can see this myriad of this starry sky appearance of drusen here in a patient with cuticular drusen, and we found that this was associated with the complement H factor gene that is involved with inflammation in the body. We're also looking at pharmacogenetics. I told you that AMD is not one disease, and we're finally realizing that all patients don't respond the same way to a given drug. So we're comparing the genes in a group of 400 patients that we've treated here at the University of Iowa with wet macular degeneration. So we're one of the few institutions that actually treats people with macular degenerations. We have the experts that can determine how they've responded to treatment. We have the genetics that then can compare the genetics to the response. And then we have the engineering, the bioinformatics experts that then can crunch these numbers and see which genes respond well to treatment and which do not, which give us clues into this disease. And then we're going for the heart of the puzzle with our brute force, the Big Chip project, where we have 500,000 SNP chips. In other words, they look at 500,000 individual loci along the whole genes, all of the genes. We have 800 patients. We actually have 1,600 patients in our database. We have 800 controls. We have 40 modifiers, in other words, whether they get atrophy or choroidal neovascularization or what type of drusen. So if you look at all these, we have 12.8 trillion variables to look at. That's a big data problem. So if you look at 13 trillion things, some of them are going to come up and be related. So how do we do that? Well, Dr. Stone has come up with the method that we first used. The 400 patients, find out what's significant, and then see if we can find out the same thing in the next 400 patients. If you find the same thing, you start to think that maybe these are really associated, and the association is not by chance. So why is this important? Well, we know there are genetic factors, but there are also modifying genes. These two pictures are from members of the same family. They have genes probably for macular degeneration. This is the brother who has drusen. There are a few drusen here, very mild. This is his younger sister. His younger sister ate a good diet, exercised, did everything right, but has much more severe disease than her brother. And why is that? She has either bad genes or either he has good genes that are modifying the risk for macular degeneration. And if we can find out these, we can find out clues to curing this disease.